If you've ever been deep into keto, and then, out of nowhere, your calf locks up, you're not imagining things. Muscle cramps are one of the most common reasons people feel like keto isn't for them. The good news is that cramps usually aren't mysterious. They're often a predictable side effect of how keto changes fluid balance, minerals, and even how your nerves signal muscles. In other words, the cramp is often a clue, not a character flaw. In the next few minutes, you'll get a simple mental model for why cramps happen on keto. Then you'll hear what tends to help and what's more hype than help. We'll focus on practical steps you can test safely, one at a time, so you can figure out your personal trigger. And we'll also cover a few red flags, because sometimes a cramp isn't just keto. Moving to slide 2, start with the biggest driver. Keto makes you lose water and sodium faster. When carbs drop, insulin drops. Lower insulin tells your kidneys to release more sodium. And where sodium goes, water follows. That's why many people see a quick scale drop early on. But it also means your blood volume can dip a bit, and your muscles may become easier to irritate. Sodium isn't just salt. It helps maintain fluid outside cells and supports normal nerve impulses. If sodium intake doesn't match what you're losing, cramps can show up at night, during workouts, or even when you point your toes. This is also why cramps often hit hardest in the first 1 to 3 weeks, or after a sweaty day. The key idea is simple. Keto changes your baseline needs. If you keep eating low salt out of habit, your body may feel it fast. Moving to slide 3. Next is potassium, which works like sodium's partner. Sodium mainly lives outside cells. Potassium mainly lives inside cells. Your muscles need that balance to relax after they contract. On keto, potassium intake can drop without you noticing, especially if you cut fruit, beans, and starchy foods and don't replace them with potassium-rich low-carb options. Also, if you're losing more fluid, you can lose more potassium along with it. Low potassium doesn't always feel like a clean, obvious symptom. It can show up as weakness, twitching, or cramps that feel deep and stubborn. The goal isn't mega-dosing potassium supplements. Too much potassium can be risky for some people. The smarter move is food-first potassium: leafy greens, avocado, mushrooms, and certain fish. Think of potassium as the relax mineral that helps your muscle fibers reset for the next rep. Moving to slide 4. Then there's magnesium, the mineral most people associate with cramps. Magnesium helps muscles relax and supports normal nerve transmission. If you're low, your nervous system can feel amped, and muscles may cramp or twitch more easily. Keto can expose a magnesium gap because many high magnesium foods, like certain grains, are reduced, and because higher fluid loss can pull minerals with it. Stress, poor sleep, and heavy training can also raise magnesium needs. But magnesium isn't magic, and not all forms are equal. Some types are more likely to cause loose stools, which can actually worsen mineral loss. A practical approach is to start low, go slow, and pay attention to both cramp frequency and digestion. Magnesium glycinate is often tolerated, while magnesium citrate is more laxative for many people. The main takeaway: magnesium can help, but it works best when sodium and potassium aren't neglected. Moving to slide 5. Here's a piece people miss. Cramps aren't only about minerals. They're also about hydration strategy. On keto, you may drink more water because you feel dry, or because you're trying to flush ketones. If you add lots of plain water without replacing sodium, you can dilute what's left. That can make cramping more likely, not less. The goal is not maximum water. It's the right balance of water and electrolytes for your sweat rate and diet. A simple check is your thirst and urine color. Pale yellow is usually a reasonable target for many people. If you're constantly peeing clear and still cramping, consider that you may be overdoing plain fluids. Another clue is dizziness when standing, headaches, or a flat feeling during workouts. Often, a salty broth or an electrolyte drink with adequate sodium is more helpful than another giant bottle of water. Moving to slide 6. Training is another major trigger. If you switch to keto and keep the exact same workout intensity, your muscles may fatigue differently for a few weeks. Glycogen, stored carbohydrate in muscle, holds water, and it also supports high-intensity output. When glycogen drops, you may feel fine at easy pace, but cramp when you sprint, climb, or push heavy sets. Fatigue itself can increase cramp risk because tired muscle fibers misfire. Add sweat loss on top, and you've got a perfect storm. A useful strategy is to temporarily reduce intensity while you adapt. Keep movement consistent, but pull back on all-out efforts. Warm up longer than usual, and be cautious with long static stretching when you're already tight. If cramps happen mid-workout, it's often a sign to pause, rehydrate with electrolytes, and reassess your pace rather than forcing through it. Moving to slide 7. Now let's talk about the keto flu cluster, because cramps often travel with it. When electrolytes drop, you may also notice headaches, low energy, brain fog, constipation, or a racing heartbeat. These symptoms can reinforce each other. For example, constipation can increase if you're low on magnesium or if you're dehydrated, and that can make you feel more stressed, which can worsen sleep, which can worsen cramping. So instead of treating cramps like a standalone problem, treat the whole pattern. If you have cramps plus headaches plus lightheadedness, sodium is often the first variable to test. If you have cramps plus constipation, magnesium and fluid balance may be more relevant. If you have cramps plus weakness, potassium and overall calorie intake might be the bigger issue. The point is to look for the bundle of symptoms that matches your situation. Moving to slide 8. Let's get concrete about what might help in real life. First, consider sodium as a daily baseline, not an emergency fix. Many keto-friendly whole foods are naturally low in sodium unless you add it. Salting meals to taste is a simple start. Some people also do well with a cup of salty broth, especially before training or in the evening if night cramps are common. Second, build potassium into meals with keto staples like avocado, leafy greens, and mushrooms. Third, if you want to trial magnesium, pick one form and keep the dose consistent for a week so you can actually judge the effect. And finally, don't change 5 things at once. If you do, you'll never know what worked. A calm, test and adjust approach usually beats chasing the newest electrolyte hack. Moving to slide 9. A quick word on electrolyte products, because the label can be misleading. Many mixes are heavy on potassium and light on sodium, but for keto cramps, sodium is often the main lever, especially early on or if you sweat a lot. Another issue is sugar alcohols or sweeteners that don't agree with your gut. If a drink mix causes bloating or diarrhea, it can worsen dehydration and mineral loss, which can worsen cramps. So read the ingredient list like a detective. Look for a meaningful amount of sodium per serving, and be cautious with mega doses of potassium unless a clinician has guided you. Also remember that more isn't automatically better. Your goal is steady, not extreme. If you use a product, treat it like a controlled experiment. Same serving, same time of day, and track whether cramps actually change over several days. Moving to slide 10. Food choices can quietly set you up for cramps, even if your macros look perfect. If your keto is mostly meat, cheese, and added fats, you can end up low in magnesium and potassium. If it's mostly packaged keto snacks, sodium might be high, but potassium and magnesium can still be low, and digestion can get weird. A more cramp-resistant keto plate tends to include mineral-rich whole foods, leafy greens, herbs, avocado, nuts in reasonable amounts, and protein that isn't overly processed. Also consider calcium, especially if you cut dairy. Calcium plays a role in muscle contraction and nerve signaling. You don't need to obsess, but you do want a balanced mineral intake across the week. A useful mindset is keto plus minerals, not just keto plus fat. Moving to slide 11. There are also non-electrolyte reasons cramps can spike on keto. One is simply undereating. Appetite often drops, and if calories fall too low, training stress feels higher and recovery gets worse. Another is sleep disruption, which some people experience during adaptation. Poor sleep raises stress hormones and can make your nervous system more reactive. Caffeine can add to that, especially if you're using it to push through low energy. And then there's alcohol, which can increase dehydration and disturb sleep quality. 2 cramp multipliers. None of this means you can't do keto. It means cramps may be a sign that your overall load is too high. Diet change plus hard training plus low sleep. If you reduce one stressor, cramps often calm down even before you perfect electrolytes. Moving to slide 12. So how do you troubleshoot cramps without guessing? Use a simple 3-step sequence. Step 1. Check sodium and fluid balance for 3 days. Salt food to taste, consider a salty broth, and avoid chugging plain water. Step 2. Add potassium-rich keto foods daily for a week, especially if your diet is low in plants. Step 3. Trial magnesium consistently and stop if your digestion worsens. While you test, keep training and caffeine stable so you're not moving the goalposts. Also note timing. Night cramps can suggest overall daily electrolyte shortfall. Workout cramps can suggest sweat loss or intensity that's too high during adaptation. If you track just 2 things, cramp timing and what you changed, you'll usually find a pattern quickly. The goal is not perfection. It's fewer cramps and better function with a routine you can actually maintain. Moving to slide 13. Now for the important safety piece. Most keto-related cramps are benign and improve with better electrolyte balance. But some situations deserve medical attention. If you have severe cramping with significant weakness, confusion, chest pain, fainting, or a heartbeat that feels irregular, don't try to salt it away. If one leg is swollen, warm, and painful, that's not a typical keto cramp pattern. If cramps are persistent despite reasonable electrolyte intake, or you have kidney disease, heart conditions, or take medications that affect fluid or minerals, you should get individualized guidance. It's also worth noting that extreme restriction, frequent vomiting, or ongoing diarrhea can rapidly disrupt electrolytes. Keto should not feel like a constant emergency. Your goal is steady energy and stable performance. If you can't get there, it's a sign to pause and reassess with a professional. Moving to slide 14. Let's wrap this up into a clean takeaway you can remember. Keto changes how your body holds water and minerals, especially sodium. That shift can make nerves and muscles more irritable, and cramps are a common result. Potassium and magnesium matter too, but they work best as part of a balanced electrolyte picture, not as a single miracle supplement. Hydration is about balance, not volume. Training intensity, sleep, calories, caffeine, and alcohol can all push you closer to the cramp threshold. If you want one practical starting point, make sodium consistent and mineral-rich foods routine, then adjust from there. If this was helpful, subscribe for more evidence-based nutrition explainers without the hype, and comment with your experience. Do your cramps respond better to A, more salt, or B, magnesium? This information is not a substitute for medical advice. Stabilize glucose. Unlock real energy.